5-Minute Pearls for Clinical Practice. This week's pearl is called Access, the 5-Minute Weight Loss Consult. Hello, this is Dr. Brian Morris, and this is 5-Minute Pearls for Clinical Practice, where you will learn the tools to provide exceptional care for your patients. This is the weekly podcast where you will be introduced to time-tested, evidence-based patient care strategies that aren't always taught in schools or training programs, but are nonetheless crucial for success in clinical practice. And each podcast episode is only about 5 minutes in length. I've been practicing internal medicine for 20 years. I went to medical school at Johns Hopkins, I trained at Yale, and I previously held a teaching position at Harvard Medical School. I currently practice medicine and hold a teaching appointment at UCLA Medical School here in Los Angeles, where I teach these patient care strategies to medical students, house staff, doctors, and other healthcare providers. This week's pearl is called Access, the 5-Minute Weight Loss Consult. All of us who work in the healthcare system encounter patients who struggle to lose weight, from surgeons to primary care providers, from chiropractors to dentists. We all see patients who face challenges such as type 2 diabetes, hypertension, sleep apnea, and many other problems which are at least partly related to being overweight or obese. Although healthcare providers are spending more time discussing with patients the importance of reaching an optimal weight, I hear from many clinicians who believe that trying to help patients lose weight is either too time-consuming or unlikely to contribute to long-term success. With office time with patients shrinking, many clinicians never address this very important but very sensitive issue with patients. What I'd like to discuss today in this podcast is what I call the 5-Minute Weight Loss Consult. It's a very simple mnemonic to remember that can help guide you through the process of counseling patients on how to begin a weight loss program that's likely to be successful. If you've reviewed the literature on weight loss, you've probably discovered that there remains a lot of controversy in the literature about the pros and cons of various weight loss programs, so I'm not going to explore the nutritional specifics of various dietary programs in this podcast. What I'd like to do here is focus on the elements specific to helping patients launch and sustain a long-term program to reach an optimal weight. How to effectively counsel your patients to reach their weight loss goals. Before I get to the mnemonic, which is Access, I do want to mention how important it is to weigh and calculate the BMI whenever you see a patient. Every time you check vital signs, in my opinion, the weight and the BMI should be calculated. The BMI is the body mass index, which is essentially the ratio of weight to height. There are now many websites and apps that help with the BMI calculation. My rule of thumb is that if you're checking a patient's blood pressure or really any vital sign, you should also check the patient's height and weight and calculate the BMI. Weight isn't a perfect marker for health, but it's usually the easiest one to check in most office settings, and it's the one that's easiest for patients to monitor. Checking each patient's weight at the office serves two functions. It helps the clinician to monitor the patient, and it also informs the patient about a very important piece of data. Many patients don't weigh themselves at home, so checking a weight at the office can alert patients to a problem that may not be on their radar. The key point here is that all clinicians should have some measure of weight integrated into their standard vital signs whenever possible. Once the clinician and the patient are aware that the patient is overweight or obese, it then just takes a few minutes during the office visit to help patients create a sound, reasonable, comprehensive weight management program rooted in the principles of healthy lifestyle habits rather than quick fix, gimmicky diets. Permanently changing patients' habits rather than quick fix diets is the best way to maximize patients' chances of losing weight and keeping it off long term. So I'd like to propose a very simple 6-step process that we use with patients and that should take no more than 5 minutes in the office setting. This is the mnemonic ACCESS, ACCESS. This can be easily documented in patient records and can be incredibly helpful to the patient who should walk out of the office feeling empowered with tangible, practical tools that can be implemented immediately. Now, this podcast episode is running a little bit long, and we still have a lot more to cover. So we will continue with part 2 of this Pearl with the next podcast episode. So please download the next podcast episode to hear part 2 of this Pearl ACCESS, the weight loss consult. See you on the next podcast episode.